Dr. Richard Kaul of New Jersey Spine and Rehabilitation has begun Project Backbone, an initiative that will provide no-cost back and spine care for veterans of the conflicts in Iraq and Afghanistan.
There have been huge advances in spine care over the last 5 to 10 years, which we routinely use now on civilians and patients that we see here in private and academic practice. But because of what I understand to be the insurance structure of veterans coming back, a lot of these young guys were getting denied access to this care.
I fell during a training exercise at Camp Shelby, Mississippi, while we were mobilizing to go to Iraq.
Anthony Sakala was an E4 cavalry specialist and served in Iraq for 15 months.
They did a couple things. They just basically gave me some muscle relaxers, you know, it's bed rest, this, that, and the other thing. And I did that, and you know, I felt a little bit better when I was done with my bed rest. I mean, but my back just wasn't the same after that.
He suffered a serious back injury, and after extensive administrative hurdles with the VA, he decided to see Dr. Richard Kaul at New Jersey Spine and Rehabilitation.
Well, he sustained injuries to 3 of his intervertebral discs in his lumbar spine, and these discs became herniated. They led to an onset of initially severe back pain, with the subsequent development of symptoms in his legs. So he began to develop pain going down his legs, and this was associated with progressive weakness and episodes of numbness and tingling.
So far it's been great. I mean, I got an appointment pretty quick with Dr. Kaul initially, and I mean, he just started the ball rolling right away. I mean, I probably had an injection within 3 weeks of starting with Dr. Kaul, and I mean, more than anything else, the injections really, you know, helped me just to live, you know, a normal life without, you know, too much pain medication or anything like that. The injections just really, you know, help me get moving.
This is a model of the complete spinal column, and I'm going to use the model to describe the injuries that we've seen, that are seen most predominantly with war veterans.
According to a military study, 56% of all fractures suffered during combat were spine-related, and additional spine injuries occurred from carrying heavy loads long distances. A 2001 study from the Army Science Board recommended soldiers not carry more than 50 pounds, yet they continue to carry up to twice that much for several miles.
And with the war veterans coming back from Iraq and Afghanistan, one of the more frequent injuries that we've seen is the acute herniation of the intervertebral discs. And you can see on this spinal model that is represented by this slightly pinkish gelatinous structure here, and what that represents is an extrusion or a propulsion of the disc contents out of the disc, and as that happens it begins to irritate the nerve root, which is represented by this yellow structure, and that leads to an onset of a variety of leg symptoms, which can include numbness, tingling, and weakness.
Day to day, you know, just lifting, moving things. I mean, I was a driver, so, you know, different maintenance things I had to do on my vehicle definitely aggravated my back. Some of the gear that I had to wear, the IBA, which is the bulletproof vest, so to speak, really, I felt, you know, helped further, you know, my back pain. And
Project Backbone offers veterans the opportunity to receive no-cost consultations and no out-of-pocket expenses for surgical or pain management treatment.
Well, the Project Backbone, it's coming out of our pocket, and you know, the funding for these cases and the work that we're doing with these cases is pro bono.
For more information regarding Project Backbone, please go to www.njsrlaserspine.com/project-backbone.
Medicine generally, and particularly you see this in spine, is moving away from an aggressive open surgical approach to one, minimally invasive techniques, and ultimately to not having surgery at all, because we'll be addressing spinal conditions earlier through the utilization of stem cell therapy and genetic manipulation.